heard shall come forward to the.
Here. Here. Here.
Any?
Aye.
Any opposed? Not motion. Okay, so we've got us six plus Dr. Patton that can vote and you, you. Paul will just, let you know or raise it.
But we're gonna have to mute that because I ain't gonna be able to handle it.
Paul will just, Go ahead and move on to the approval of the agenda.
I think I just saw the CD. I'm okay with it. You can explain it when we get there.
Correction.
Aye.
Any opposed? Now we start out, we got a couple opportunities for the. Carol, I was able to. Actually have 4 board members. Have to. Time meeting with the vice chair, self, and County Commissioner Mary Alfred last Thursday. And she asked that we meet so that she could, county staff are working on, which is an actual childcare center for first responders, 24-hour childcare center for first responders. There is a lot that goes into that. And she had a lot of meetings in addition to meeting Bradley and a lot of the stakeholders. At that meeting, Patton was not able to attend. Board were there. Us were there. County staff there. I mean, it was responding to 911. When it comes to the county doesn't have a lot of expertise. He said they have not yet reached out to them. Asked for legislative. There's a lot that goes into it. There's a lot that goes into it, yeah. That was. Yeah, and I think, thank you, Commissioner Pincus, and I think the reality is in addition to the private sector, ELC was at the meeting. Have a lot of expertise at the trust. And they just, we got to have a voice there. So if I could get two motions to refer both of those items to staff, that would be my chair report. Yeah, I think just engaging with the county staff on that issue. I got a motion and a second. Thank you. Is there any public discussion? Yeah, y'all can hear me now, can't you?
It's just fading in and out. Yeah.
I will speak slowly and softly for the microphone. All right, let's bring it back to the board on that motion. All those in favor say aye. Any opposed? Okay, that motion carries. Thank you, members. Okay, that's the chair report. We now move to the executive director's report. Director Kiner.
Thank you. Oh, I hear me. Uh, Kind of just piggybacking on the chair's report, you all, we had a great week at Children's Week. Actually, I looked up and looked at Herman. We saw Herman there. Just a really good week. Thank you, Chair Cornell, for taking time to come up and walk the halls of the Capitol with us. Of all of the FACT folks, the Children's Service Councils and Trust, we had more visits. Our delegation welcomed us with open arms. We were able to see all five of our folks, from the senators to the representatives. Really good meetings. We didn't have an ask this year, although, of course, we were hearing that property taxes that certainly is an issue. We were listening and we did ask about it, but we were told that they weren't expecting it to move this year, but that there was probably going to be some movement in one direction or another next year. So it was timely for us to have the conversation about potentially bringing on board a lobbyist should we need one moving forward. Yes, sir.
As far as what's going on.
So there has been, oh gosh, maybe 5 or 6 different bills talking about making changes to property taxes, from getting rid of property taxes altogether to some homestead exemption, extensions. I believe the one that passed was something to do with agriculture, and property taxes really wouldn't impact us. But we've been told that this is an issue that is going to come up during next session. So we're going to be watching it. Certainly not knowing which way it's going to go. There literally have been discussions about taking property taxes from the county and letting the legislature kind of control that. I sat on a committee meeting. It was about 1 hour and 20 minutes and listened to our legislators go back and forth about it. So what we know for sure is that there are going to be some changes. How that will impact us, how much it will impact us, we don't know yet. So I don't feel like we need to panic at all, but we do need to keep an eye on it. FACT is doing that. And so we'll be following this property taxes issue. Yes, sir. So during our time in Tallahassee, we were able to attend the early learning leadership breakfast, where one of our own was recognized. Russell Scotes is the president of Small World Daycare Center, Daycare and Learning Center. He's a BLI graduate. He is one of our mentors. Russell is one of our local rock stars and doing a lot statewide. And we were there for his graduation, and we didn't even know he was graduating. So we got to cheer him on. And I think he was really happy that we were there. We also got to tour and visit with our sister CSC Leon County. They have literally just opened a family resource center. And so it was very interesting to see their model. It is housed in their office space. So that's a little bit different. They are fully funding it for the next, I believe, 3 years? 3 years. That again was interesting. And so some of our takeaways is, again, that all of us are different. We respond to our community's needs, and what fits for Alachua County may not fit for Leon County, but there are similarities and we can learn from one another. I know Ken and the executive director of Leon, we kind of stood there and they had a really good conversation about how we fund, right, our programs and why we fund the programs that we fund. So all in all, you all, it was just a really great visit. And I want to say thank you to staff. Belita pitch hit it for us since we don't have a community engagement person right now. She was our community engagement person at our table. And we partnered with ELC this year. So it was just a really great visit. Oh, and I almost forgot about our teens. We had teens from Alachua County at the Capitol on Teens Day. Let's see, Amplify, the youth group that represents the school system was there. The NAACP Youth Council was there. And I believe there was a third group. Can't remember. I'm looking at, no, Christy. Christy was there. We saw her. So Alachua County was well represented at Children's Week this year. So I just could not highlight what a great time we had. Looking forward to doing it again next year, taking even more young people. We're talking about how we want to partner with ELC for next year because they want to bring some of the littles up. So exciting times in 2026.
Okay, any questions for the director? A couple of just quick comments. First of all, you ever been up to Tallahassee during Children's Week? It is a massive, awesome, incredible week. It is a madhouse. There are so many kids up there, but one thing that is clear is that kids are definitely a nonpartisan and just an awesome kind of issue. Everyone unites around these children's issues. Our staff up there was unbelievable, and Alachua County, even though we didn't have a specific ask, we may start to have ask, and so relationships are already being built. And I was able to kind of learn about some other children's service councils, and the big comment that I would say is, if you've seen one, then you've seen one. Because they're all completely different. And what I would say about ours is that the amount of programs that are small but mighty staff is able to manage based on the size of ours is really incredible. And I just have so much admiration for our staff. I know you all feel the same way. It became really evident when I was up there. So great week. Thank you for forcing, she blocked me out for a couple of days, and I don't know how you did it, but you did it, and I was there, and I was so glad I was there. So Commissioner Peterson. Call Marcia. Dude, I'm sorry. Did you make this microphone right here? No. And ask her if, when that time comes, there's definitely some things that we're going through the legislature that would have seemingly an impact on what we do as far as certification and other things. So, when it's all said and done, because I know it's been extended. And the budget is really why, the grand bargain is ad valorem is for local governments and sales taxes for state government. And we've got an argument between the speaker and the governor. Governor wants to cut ad valorem and the speaker wants to cut sales tax. They're gonna come up with some compromise, and as Marcia said, it'll probably get put to the voters in the next session on a ballot initiative, but just being able to talk about the impact to special districts and then specifically to children's special district was really important and impactful for legislators. And to your point, Lee, one of the things that a lobbyist would do, not only in preparing us, but after session, then they kind of help us decompress with not only our local issues, but the statewide council issues, because they all. Marcia, just so you know, one of the reasons they were so happy to see you is because there was not an ask. That's right. Yeah, yeah. Okay, is there anything else from the members? Anyone from the public on the executive director report? Okay, let's go ahead and move on then to our committee updates. We've got some really great items on the agenda today, and we've got plenty of time, a couple of hours, so I don't want to rush, but I do want to keep moving. So we're going to start out with the Sunshine State Early Childhood Information Portal. We've got Mia Jones and Dr. Knopf from the Anita Zucker Center. And the recommended action on this item, commissioners or members, is just to receive the presentation. All right. And so with that, Mia, you are recognized.
Hello, everybody. Let me tell you a little bit about the Sunshine Portal. So today, we have Dr. Herman Knopf from the Anita Zucker Center for Excellence in Early Childhood Studies. He's going to present on the Sunshine Portal and the Florida Index of Child Care Access, the 5.1 map. The Sunshine Portal is a comprehensive resource for early childhood data in Florida. The Sunshine Portal is pioneering early childhood integrated data systems designed to provide vital information from across the early childhood mixed delivery system. So I put it in their staff report, but I really want him to come and he's going to walk us through what that looks like, and he'll talk a little bit more about it.
Oh, thank you for being here.
Thank you for asking me to come and share some of the work that we've been doing with you guys today. As Mia said, the Sunshine State Early Childhood Information Portal is a large comprehensive project that's currently funded by the state Department of Education through the Division of Early Learning for us to establish an integrated early childhood data system that brings together information from healthcare, social safety net support services, and education programming in the state of Florida, where we bring those data together and link it at the child level so we can look at how systems and supports that children and families are participating in are actively working to support positive outcomes, both for children and for families. Some of our work is focused specifically on education outcomes as it pertains to children, namely VPK participation and kindergarten readiness as measured by the VPK assessment that's deployed during the VPK year, as well as we do another look at that at kindergarten readiness as kids enroll in kindergarten. And we've also been asked by the legislature and prepared a report to the governor's office to describe the extent to which families are participating in other social support systems and networks, so that we can look at how families are using the services and supports that are available to them. Initially, we were hoping we would be able to use those data, some of the administrative data, to measure and document economic mobility for households, but we learned in the middle of midstream or mid-project that none of our state data systems are capturing family history as it relates to economic mobility over time. And so that we know point in time economic standing as it relates to families' eligibility for services, but those data systems aren't capturing long-term history. So we weren't able to document change over time. But our team has started to work with CareerSource and some other state organizations to try to get access to those data so that we can describe those supports as well. Today, we're just going to focus on childcare access, which is kind of the first suite of support tools that we've developed. And to find us, you just Google thesunshineportal.org. And these are tools that are meant for you and other, county level as well as state policymakers and implementers to be able to explore how systems and supports are being made available to children, how children and families are using those services to help guide your decision-making and your planning processes as you move forward. All of our tools are updated annually, usually around September, October, once the state kind of closes their books on the prior fiscal year and they verify that all the data are in lockdown and are not going to change, then we will take those data and then upload our metrics up onto our website so you guys can see how those things change over time. The first tool that we developed, and it's now in its 5.1 or fifth version of the tool, is we call it FLICA. It's the Florida Index of Childcare Access that looks specifically at child and family engagement and participation in Florida School Readiness Program, which is a child care subsidy program designed specifically to help families access child care and maintain their employment or maintain their engagement. And we've been, uploading this data and created these metrics aligned with and in partnership with early learning coalitions throughout the state, children's trusts and councils throughout the state. And we've continued to refine the measure and to refine our dashboards to identify tools that quickly communicate what they've identified as kind of some of the key bits of information that they need to understand how the systems are operating. And specifically related to FLICA, we're looking at whether or not we have enough high quality early care and education spaces to serve children who are participating in Florida School Readiness Program. A note about kind of the limits of our data is the data that we're using are all administrative derived data. So these are, based on the payment records for children and families that are participating in the School Readiness Program and the reported licensing capacity of child care providers throughout the state, so that we know these are durable. We know these are accurate reflections of what has been paid on behalf of children and families to access childcare, but they do not include total enrollments, because that's not information that the state currently has the capability of collecting. And so when we're looking at an area or zip code that is showing a deficit of high quality spaces to serve kids, know that the deficit is only to serve kids who are receiving subsidy. And in a likelihood, the deficit is far greater than what might be reflected in the maps, because there are far more families that are accessing and enrolling in childcare that are completely full family pay. So they're not receiving any childcare subsidy to access those childcare spaces. So the first tools in our dashboard across the top are first to look at providers by quality level, and we've color coded and we have 5 years of data so that we can see over time how that has changed. And this is all interactive. And so this dark blue is our, providers that have a class quality score of 6+. If we wanted to really compare that more directly over time, we can select it. It shifts that color band all the way over to the left so that you can do a much cleaner comparison and that number over time. Yes. Yes, let me explain that tool. So in the state of Florida, we use the classroom assessment scoring system to measure the quality of teacher-child interaction in early learning settings. It is a tool that's an observation-based tool where a valid and reliable observer will go into the classroom, observe how the teacher is interacting with the children in that learning environment, and then we'll rate the quality of those interactions on a 7-point scale. So 7 is the best. Almost nobody gets a 7. Less than 4 is not meeting the expectations for a provider to be contracted with the state to deliver school readiness services. And you can see that number in Alachua County. The number has declined over time as the Early Learning Coalition and Children's Trust have been engaged with providers to improve quality. We've seen that the number of and the percentage of providers that are scoring below that 4.0 threshold has diminished to nothing. We do have every year we have a varying number of providers that do not have a score, and that's an artifact of state policy as it relates to the school readiness program. And so a provider is required to have that class observation if 20% or more of their capacity is allocated to the school readiness program. So if they have low school readiness enrollment within that provider, they're not compelled to have a class score, but there's still a carrot, right? So it's so that they are incentivized to request those. And so if they have low enrollment, they can request that observation, because the subsidy rate will change, so providers can get a bonus if they have a score above a 4.5, and then another bonus if they score above a 5. So there's an incentive for providers to request that observation so that we have that information, but there will always be some number of providers every year that do not have a score because they're not required to, and some of them might frankly not want somebody in there observing their teachers. The second kind of band is looking at our enrollment and how our enrollment distribution has changed over time. And you can see that the percentage of kids that are in higher quality performing programs or classrooms has continued over time. The percentage of kids that are in a lower quality or between 4 and 5 has diminished over time. I think it's a good measure that some of the things that we're doing in our community are working to support providers to offer higher quality services as they're measured by the classroom assessment scoring system. These, I think, are important for us to look at, but we don't have a lot of influence over the enrollment by care level, because it really just depends on which kids show up and apply for the services and then are granted eligibility for those services. But it does give us some look. And if you look at the kind of the trailing edge of all of these bar charts, you can see the overall volume of providers enrollment that we're seeing in Alachua County. And we see that we have a declining trend in the number of children that are participating in the school readiness. Part of that is due to the fact that the eligibility criteria are currently set at 150% of the federal poverty line. But if you have 2 adults in the household working full time, making minimum wage, they're over income at 150% of the federal poverty line. And so it makes it difficult for some families that are intact, with both, with two parents in the household doing what they're supposed to do, working full time to make ends meet. They're going to be over income for the service, which I think we're starting to see as the minimum wage increases are starting to take hold in Alachua County. The legislature has passed legislation this session to move us off the federal poverty line as a measure of eligibility. I believe they've set state median income at 55%, which is an improvement over the 150% of the federal poverty line. But I think what's most important there is that it moves us off the federal poverty line, which is a national measure that doesn't include the specific context in Florida of what minimum wages would be. And so that it puts us into a place where that's more likely going to move naturally as wages and minimum wages increase over time. That state median income is also going to increase at a baseline, and it also makes it easier in the future for the legislature to look and see how many kids are coming in the door that are over income, and there may provide some justification for them to change that SMI number from 55 to some other number that might make sense based on funding allocations and abilities. The last item at the top of the dashboard is our SR utilization rates, and this is a tool that we've added fairly recently because we were hearing rumors from a lot of early learning coalitions and advocates in the state telling us that if we just increased rates, how much we pay per child in the school readiness program, that we would generate additional revenue at the provider level that would lead to better wages for the early care and education workforce. That would work if 100% of the center was school readiness funded. And if our rates that we paid were greater than the price that providers typically charge. But in reality, providers charge a rate higher than the reimbursement rate. And then so when a parent enrolls in Herman's preschool program, let's say I charge $350 a week, a family enrolls with me, they can qualify for maybe $300 readiness program. And so the parent is on the hook for the difference. So the parent has to pay that $50 to me every week to remain enrolled in the provider. If we increase rates to $325, it's great for the families because they pay $25 a week instead of $50 a week, but I still get $350 a week. So my income profile hasn't changed. So you've increased rates, you've made things better for families, which is great, but you haven't changed the revenue profile for childcare providers. And so you haven't changed their ability to pay personnel differently. Which is an issue that many of the early childhood advocates across the state are kind of grappling with to identify other ways to better support the workforce. But also there was a misunderstanding of how many providers have high utilization where much of their capacity is being allocated to school readiness. And when we started sharing this utilization rate, folks were seeing that, like in Alachua County, for example, 50% of our providers have a utilization rate of 20% or less. So only 20% of their space is school readiness. The other 80 is private pay. And so we don't have, as a state, we don't have a lot of influence over their business operations if we're only influencing 20% of their service or their revenue. The maps, which is, I think, what I'm going to get excited about, is where we're sharing a couple of things. First, the background. We're sharing the percentage of children in that zip code that are enrolled in high quality school readiness care. And then the numbers on top of the map are showing us kind of the over under on capacity. And so 32 means that we have 32 more spaces to serve kids in a high quality setting than we have kids, which is good. Black numbers on this map are good. Now, if we change the quality level, which we can do in our interactive map, and let's decide in Alachua County, if we're really going to consider a provider high quality, they should be delivering services that are a 5.0 on that 7-point scale that we talked about before. Is that it changes the map. And it changes our distributions here. And so that a lot of this map was dark blue before. Now we see it's a lighter blue, showing that a smaller percentage of providers are offering high quality services. When we say it's 5, to make it really look bad, let's go full insano and let's say 6.0 on the scale. And now you see that most of our zip codes in Alachua County will show up as having inadequate supply to serve the number of SR kids that we have enrolled in that zip code. But we didn't think that was quite enough information and we haven't overloaded anybody yet. So we also decided it was important for you guys to be able to look specifically at providers, where they're located, and to be able to pull up some information about this provider. Let's go back to reasonable. So we've changed the class threshold to 4.5 on that 7-point scale. And so we've plotted all of the providers that are right now contracted to provide school readiness services in Alachua County. We've color coded them based on their quality level. And so a provider that has a class score above 4.5 and or gold seal are this dark green color. They provider that has a high class score and is not gold seal is this lighter color. And then these also show the percentages of providers that fall into those classifications. So that we have more information about the providers. And so, you know, if let's go back to a 5.0 and it'll change the colors of the dots because we've changed our quality threshold for those providers in those communities. And so if we wanted to change this and make it a darker colored blue and 32669, we can look to see the relative quality of the providers in that area and identify the coalition or the Children's Trust could identify which providers do we want to work with that would have the most significant impact on our capacity to serve them in high quality arrangements. And so this is really meant to be an action-oriented tool that doesn't have just a static report. This is something that when we're coming together to identify challenges that we want to face or improvements that we want to make within our community, we bring the stakeholders together to interrogate these maps and to create a plan. Couple minutes, I'll just do a quick advertisement for our newest tool, which is the FLICA's little brother, which is the Florida Index for Preschool Access. Just released this tool a few weeks ago that looks specifically at the VPK program in the state of Florida. Which represents a different population of children and families that are eligible for the program. So, you know, just as a reminder for those in the audience that may not know, VPK is open to any family that has a 4-year-old that lives in Florida. So it's not a means tested program like the school readiness program is. And so that it gives us a more fine-grained look at how those services are being used within our community, because we have, as reported by each provider, whether it's a public school or private school or private preschool program, how many 4-year-olds they can serve in each classroom that they offer services in, so that we can do a much tighter look at how the services are being used. And so when we look at utilization rates, we've separated out center-based from public school so that we can really kind of see what that distribution looks like in different contexts within the community. And it's important to note that many of our public school VPK classrooms have some children that are VPK receiving kids, and they have other children who have an IEP or other special education needs are enrolled in that 4-year-old class as an opportunity to provide a mainstreamed or inclusive learning environment, so that we have children with special needs learning alongside children who are more typically developing. The children that have an IEP in those classrooms oftentimes are not enrolled in the VPK program, so they don't show up in our counts and our utilization. So some of the distribution on the utilization rate is underreporting actual full class enrollment in our public school environments, because we have some kids that are enrolled there that aren't VPK kids. But everything else on the map is pretty much the same, with the exception we're testing out a new visualization that if we hear back from our users that they like it, we will go ahead and translate this over to the FLICA as well. But we're also providing the utilization rate of providers at the classroom and program level throughout the area, so that we can see, for example, out here in Alachua, that we have Lee's Fun to Learn daycare and tutoring has enrolled, as of last year, only 8 of their total 20 capacity, and so that they were under enrolled in that classroom. And right next door, in First Christian Academy, they're almost completely utilized. Really cool when we're looking at both of these providers out there is their class scores at the classroom level are really high. So the kids that are accessing and enrolling in services out there, they're getting access to what the classroom assessment scoring system is reporting as high quality services, and we have room for more kids out in that community.
That data is coming from payment data of the provider reported into the state, or the state is providing that data back based on what
We get
they,
the data all from the state.
from the state.
Yep. And so with the school readiness program, it's based on payment data and they pay based on child attendance. And
Right.
so that we have, for every month, how many hours of service or how many days of service in the case of the VPK, the kids were there. When we pick a snapshot to report our kind of our enrollment and utilization rates, because that does fluctuate throughout the year, we pick the high water mark of the year. So that's when our system is used at its max capacity, or when we have the most users in the system, that's what we're reporting. So when we're reporting either a deficit in services or an under enrollment of services, that's when we're at our highest enrollment point during the year.
Ready for questions?
Yeah.
Okay, Member Certain,
Dr.
make sure the
Knopf,
microphone's on.
Dr. Knopf, the public schools, are they included in this last
Yeah.
version that you showed us there?
Where's our public elementary schools?
And you said that the two that you showed us in Alachua, one was under-enrolled, the other was fully utilized for V-Pre-K. Are you all exploring why, like that one center, even though they had capacity, they were under-enrolled? Was it they weren't paid because of attendance, or you don't know that? Do you know that?
We don't know. We are exploring that. And so that we've done a couple of studies to first understand the decision-making calculus in parents' minds when they're deciding to either take us up on the offer to enroll in VPK or not. And so in, Alachua County, if we use the number of kindergartners that we had the subsequent year as our denominator, we then calculate kind of the utilization rate or the participation rate in the VPK program. In Alachua County, we're at 74% of the kids that enrolled in kindergarten paid in VPK before that.
That
So
seems
what-
high. Is that good? That's,
It is good. And our numbers are going to be different than what the state estimating conference comes up with, because they use as their denominator an estimate of the number of 4-year-olds that exist within a community, which is a guess at the number of 4-year-olds. And our team really doesn't like to guess at stuff if we don't have to. And so we use how many 4-year-olds enrolled in the public school is our denominator, because we know exactly how many of those are. Those are reported. And then when we're trying to look at the number of kids that we're likely to influence through our systems, how many kids then participate in the VPK program with that as a denominator. Not perfect, because we know that there are kindergartners that enroll in private schools throughout Alachua County.
Oh, so you said for your denominator, you use the number of 5-year-olds kids that enrolled in public school, that's 5-year-olds, it's kindergartners, and you just say that they were at 1.4. Okay, thank you.
Member Pincus.
That wasn't the number that we saw, was it?
Probably wasn't, because the estimate that they probably got from the Florida Estimating Conference it's a census derived estimate of the number of 4-year-olds that live within a community, which it's a guess at how many 4-year-olds live here.
That being the case, if we're going forward, accurate to use a better. It's on.
Yeah, like Lee, like the reason I asked the question I did is we have the district is running a V-Pre-K program, and the district is actually losing money. Because they only reimburse, they pay 3 hours a day for 180 days, 540 hours, K through 5, they go the same number of hours, but it's 900 hours is what the state requires, for you to offer for minimum for elementary age kids, right? So we immediately started the deficit, and they're trying to have the ESC students to cover some of that cost, but we're actually losing money by offering V-Pre-K. And they say we have to, you have to have like a summer program and some of that, but in dwindling dollars, it is really like, I'm sitting over here saying like, hey, we're taking resources from K-5 to support this early. Not that it's not important, but when you're looking at what your duty is, it makes you really have this competition for resources,
Any other members for Dr. Knopf?
Well, I think as you guys are coming up with initiatives and ways to support the early care and education and small business owners in Alachua County, I think that it's important to look at these maps. Where providers are currently operating, where does it look like we have a deficit of high quality providers? And how might we first boost quality among the providers that are already operating in those communities? And if we maximize that opportunity and we're still seeing a deficit, what might we do to motivate, incentivize expansion of services within communities where we have enough resource that exists? I think it's really important not to assume that what we're hearing in the public media is true, which, where we have a lot of folks saying we just don't have enough. Right? So just any increase in supply is a good thing. And because it's not, is that if we stimulate too much supply when there isn't enough demand that's going to use that, you're going to make it more difficult for those small businesses to actually succeed. And so I think that it's really important that we take into consideration the context of the business environment, because these childcare providers, as much as they are actively supporting kids and families and doing really good things for our community, they still have to, depending on their tax status, they have to at least break even, if not generate some profit to support the kinds of improvements that they would like to make over time, as it might relate to, staff wages and incentives and other supports for children and families. And so I think it's really important to keep that in mind, that more isn't always good, that we need to be first looking to improve and support providers that are already in existence, to max that out. And then if we have a problem with capacity after that, to think about incentivizing.
Okay, anyone else?
I apologize, I keep going. So Marcia, it sounds like what an area might be, successful for the trust would be to see quality of the daycare. How we do that, but.
Yes, sir. I agree. We've talked about, although 74% is pretty good, we've even just internally talked about, maybe it's some kind of marketing campaign to parents about the importance of VPK. And but seeing Herman came over and did a demo of the portal for us, and understanding how important BLI is. It could just be encouraging those centers that are in these particular areas or zip codes to get involved in BLI and accreditation and so on and so forth. So I think there are lots of uses for the portal. We're excited about it. Additionally, some of the work we're talking about with convening the early learning centers and community conversation, really talking about quality versus quantity and how they can support one another, I think will be just as important.
And I think it will also continue to be important that we're also working with the Early Learning Coalition in Alachua County, as well as coalitions around the state. Why parents are electing to either enroll or not enroll in the VPK program. And I think it's going to be important for us to really listen to the families that have chosen not to participate in VPK and hear why they've decided not to do that, and not assume it's a problem in their decision making, but to value that decision and then identify what are other supports that we may provide for families that elect to keep their children wherever their kids are when they're not in VPK, whether it's in their current childcare provider or whether the kids are with an aunt or grandma or an uncle, right? I mean, families have reasons that they make those decisions, and they're not to be considered bad just because they're not taking us up on the offer to enroll in VPK. So we need to find ways to recognize and value those perspectives and then identify additional ways to support them.
Okay, anyone else? Yeah, Dr. Knopf, I'm just blown away by this data. We are a data-driven organization. I think staff will, as they dig in, really be able to capitalize on how we're providing better services to our community. I only have really one question. I presume this is statewide data. You're doing this for all 67 counties. How is the state utilizing this data?
Well, one, each early learning coalition is kind of how the programs are governed, right? So that there are 30 different early learning coalitions around the state, and they're using it in different ways. So some of them are using this information to identify other programs and other quality enhancement supports that we kind of talked about here. The state is also looking at this to see how we're tracking. So are we seeing an increase in enrollment at quality level over time? Are we seeing an increase or a decrease in overall providers that are contracting with our services? So that they can determine whether or not we have a problem that they need to investigate in at the state, right? So if we were to see a continued decline in the number of providers participating in the school readiness program, that's an early warning sign that there's something not working well with our policies that are not supporting providers' interest in engaging in the system, which would warrant further investigation.
So members, one of the things that we heard when we were up there is this fact that both the Senate and the House budgets are looking at between 100 and 120 million of reductions of funding for ELC. Side by side with our ELC partners. And so I presume, it will become very important as this data gets collected and starts to get interpreted that we are utilizing it at the local level because they are certainly going to be utilizing it. Carmen, thank you. Is there anyone from the public that wishes to speak on this item before we move on to the next one? Come on up, if you could just introduce yourself. Yeah.
Hello, my name is Sori Lindberg. I wasn't going to say anything. It's my first time. But I am the mother of a 4-year-old, so you're speaking my language. And Miss Certain too, hearing that there is a disconnect between BPK attendance and kindergarten. This is a population sample of one. I do not represent anyone else except my family. But first of all, big props to ELC and all the effort you guys do in the community. I saw the alerts to apply to VPK. I was on it the first day. I thought, time would run out. I had questions. People responded to me. I felt very supported in our community in making this decision. The first 3 years of our life, we had a pandemic baby. So my husband was a stay-at-home dad. Now we are preparing for VPK. And when we looked at public versus private, the timing was an issue for our certain family because it ends at 1 o'clock or 1:30. And to pay for the rest of it, we would be going from $0 spent to some dollars spent. So the decision we had to make for our family, I'm a public school kid through and through, love public school. She'll go to public school for kindergarten. But we chose to go private because for my husband to find a job, he would have to find a job with more flexibility. He can't just apply somewhere and say, I'm only available till from 7:45 to 1:15 because I have to go pick up my kid. She's 4. I don't know if she would ride a bus. I should have a lot of questions and talk about dinosaurs the whole time. So just for our family, it was the timing. And it is a big move from being a new parent and not having support around. So it's like, what do we do from 1 to 5 when I'm working? What does he do? So we made that decision to go to a facility that has the longer hours till 6 o'clock so he could pay for it. So he thought at first he was like, it's not fair. Why do I got to put her somewhere and get a job just to pay for it? And I was like, well, it's time. It's time for her to learn. She's in a part-time program now that we share it with. So thank you for your work on this portal. I can't wait to dig into it and figure out how I can help support and volunteer for other families that you do. And again, excellent. I'm learning. I'm new to the area. So thank you for all you do for our families.
Lindbergh, thank you for participating today. Thank you for your comments. Anyone else? Come on up. Yeah, if you've got someone, come on up. Come up to the microphone. If you could just introduce yourself and give us your comments.
With you. Excellent. Love this. And I just had one question, just curious. Ask observations and how to.
Or varies by coalition.
Hold on 1 second. Do you have any more comments? Okay, if you could just come up to the microphone and just give us that answer, that'd be great.
So the question was, who did the observers work for? And it varies by coalition. So some coalitions contract that out and they might pay the people that work for the Florida Children's Forum to come in and do observations. So they might come out of Tallahassee and do observations. Other early learning coalitions hire class observer staff internal. And so they're paid coalition staff that will go out and do those observations. And then also because of other changes in legislation. So every single VPK classroom has to be observed every single year. That increased the number of observations that needed to get done, so that they also, some coalitions had to rapidly expand where they paid Teachstone observers to come down to fill the gap with some of their observations, and then still coalition staff, and then also children's forum staff.
Question. Thank you, Herman. Okay, anyone else? All right, let's go ahead and we're gonna go ahead and close this item and move on to our next item, item 13. So this is the mini grant award. We've got Chief Operating Officer, Ms. Goldwire. The requested action is that the board is asked to approve the policies and procedures for the special funding opportunity innovation for impact grant policy 6.8 to be included in the fiscal year 25-26 budget. And with that, Ms. Goldwire, you're recognized.
Many of you should be familiar with the term mini grant. We first introduced it during a budget discussion last fiscal year. And since then, it was a pilot. So we were interested in working with organizations that had innovative ideas, organizations that didn't quite fit what we were looking for during an RFP. And so you all approved for us to allocate about $200,000 to pilot this idea. And since then, we did fund 3 programs, our Swamp Bots robotics program that you guys remember were here, did a presentation for you all, our Dance Alive organization, they funded a program, or we funded a program through them called Let's Dance, and it was a class for children with special needs. And then the third program that we funded under this initiative was through Mirror Image Leadership Academy for a program called Evolving Leaders Academy. So the purpose of this staff item is to make it official, for it to be added to our policies and procedures, up to $200,000 for the total allocation. There's a full application process. They will apply through SAMIS. We thought it worked well. We have learned of some new programs that we're hoping to pilot through this initiative for fiscal year 26. I'll stop there and answer any questions that you all may have.
Members, questions? Member
This is
Pickison?
what was done before, as far as you approved it and it went through.
Got a motion and a second to approve the recommendation, which is to approve the innovation impact grant policies and procedures for inclusion in this fiscal year 25-26 budget. Any discussion? Any public discussion? Back to the board. All those in favor say aye. Any opposed? Okay, that is approved. Thank you so much. Moving on to old business. The item 14 is the comprehensive literacy plan update. We've got Executive Director Kiner and Mia that's going to give this update, and the recommendation is to approve the requested action. The requested action is that the board is asked to allow staff up to 90 days to work with the Community Foundation along with the Center for Nonprofit Excellence to coordinate next steps in the creation of a comprehensive literacy plan and activities as recommended in the joint meeting with the County Commission. Board's asked to invest $550,000 as an initial investment to the CTAC Community Literacy Initiative. Ms. Kiner, you're recognized.
Yes, sir. Thank you. If you all will remember, after our really long meeting last month, we asked you to give us some time to come back to you to discuss the literacy plan further. At the time, we wanted to bring a recommendation forward for I believe we all settled on a facilitator. However, you all then had a meeting with the County Commission, and things changed a little bit during that discussion. The county committed $250,000, and there was a discussion specifically to work with the Center for Nonprofit Excellence and the Community Foundation on the hub recommendation that came out of the needs assessment. And so what we would like to do is we want to match the 250 that the county voted to approve, and add a little bit more in there because we believe that in order for this to get started, it's going to take a considerable amount of funding. We've had one conversation with the staff of the Center for Nonprofit Excellence. Our understanding is that the Community Foundations Board is going to meet later on this week before we can move forward. That board has to approve any actions by the Center for Nonprofit Excellence. Additionally, the school board still has to meet and receive the report. We believe that meeting is going to be on June 3rd, if I'm not mistaken. It was supposed to be next week, but we were asked if we could push it to the June 3rd meeting. I think your meeting next week was canceled or something like that, Dr. Patton said. So we're asking you for a little bit more time for us to bring you back a little bit more of a plan. But we feel fairly confident that we can work with our partners, the school system, the Center for Nonprofit Excellence, the county, on really bringing together all of our literacy partners to begin some of the work that was in the recommendation that came out of the needs assessment. So that's the gist of this recommendation. In the staff report, you see, we're going to be busy this month. We have a lot of meetings. I believe my assistant said I could not meet with anyone else because I have a lot of meetings on the calendar, and it is all involving literacy. But I'm excited. I hope you all are as well after the joint meeting. I feel like we're at a moment in time where we can actually move the needle. I heard what member Certain said at our last meeting, and several of you, that this conversation has been the same conversation over and over and over again. But it feels like to me that we have all of our partners ready to take their piece of this and move it forward. And I believe that if the Community Foundation and the center moves forward with agreeing to help us coordinate a plan, then we can get moving with a plan by fall. We are tentatively looking at bringing everybody together in July for a bit of a convening, and that's really just to put all the partners at the table to talk about their pieces, in addition to all of the community folks who are currently doing this work. From the trust standpoint, we want to have this conversation sooner rather than later, because we want to then be able to go back to our after schools, because we'll be, looking at contracts for our after school folks in July, early August. And there are some things that we may need to add to that relate to literacy. So I'll stop talking and take any questions.
Okay, members, questions? Thank you. Go ahead, ask a question and
What did we budget for this year for the literacy?
No, sir. The only budget was the 62,500 for the needs assessment.
Right.
So we
it's a big
put,
commitment. This is a big
yes, sir.
step forward.
So this is. No.
No, I think it would be part of the budget development.
So, well, I guess I'll hear it in 2 weeks, but thousand that you spoke of,
250 was from the county. That was the county's.
like to match that.
Correct. And we have that, we have money left over in some of our goals.
So what do you don't really know what you want to do with that yet?
Correct. Correct. I'm just saying I feel like we need to minimally match the county, but we're the ones who put forward the needs assessment. You all have been very clear that this is an important initiative of the trust. And so 550,000 initially to get this started, I don't think is too much for us.
When I was babbling on about over the next decade and member certain looked right at me and said, 3-year moonshot, I have had not less than 10 people around this community say, I hear you're doing a 3-year moonshot to change. And thank you, member certain, for saying that because you know, this is why you ran for school board. And I remember the meeting in the county commission office in 2014. I am ready to support this recommendation, and I'm ready to tell the county commission tonight at the joint meeting in Newberry that they took your 250 and they raised you 300 more. Because I think the county may need to put more money in this. This is not a only Children's Trust needs to fund this issue. And I think the more committed we are at this board, we are going to bring our partners along, both with their resources, but their effort and their skill. I love the recommendation. Any other?
So what can we do for, obviously, from 5, is there any way that all the data that the number of children that came into and started school weren't ready? So if somehow we can work with the preschools, parts of I think that's a, you know,
And I don't think we're there yet, Lee, for me to be able to tell you specifically what that will look like. But I think that's why we want all the partners at the table so that we can talk about well, I was going to say one of the partners that's on this list, in addition to Anita Zucker, and we had a great meeting with Herman talking about this. Reach Out and Read is another initiative that literally will go into doctors' offices with pediatricians to determine if the child's learning capacity is there. And then the Learning Alliance is another entity that is basically doing this down in St. Lucie County. So I think there's more to come. Once all the partners are at the table, then we can determine who will do what, right? Who's on first in
Do you
these
think our
various.
monies is focused on 0 to 5? And we talked about that.
Yeah, at our last meeting.
Talked about that. That's, if there's an organization to take the lead on that, that's us. And, we also talked about the school board really taking the lead on K through 12. And so I think this is,
Right.
yeah, so.
So my understanding is it will be whether or not they are willing to take on, the being the coordinator of the literacy hub. And then they have some other decisions to make. My understanding is about the center and its purpose. Because this would be, right now they're a staff of 1. So it would require Teresa to bring on some help. Oh, for sure. For sure. We still have Florida grade level reading that would be one of the partners that would be a part of this. So definitely.
This motion would be basically for them to bring back a plan to us over the.
also number 2 says
550, 250 is what the county committed.
Right. I was just sharing with you what the county put in. I said we wanted to match their 250, but add another 300,000 to it. So our total of our commitment would be 550,000.
I don't have any problem with that, but that'd be in the budget development for next year, or will we use it?
We won't spend 550,000 for between now and.
Talking about October 1.
Yeah, for the upcoming year.
We're given direction for when Scott brings us back that initial budget that this is in there.
Well, the only thing I would amend, because you can see after your discussion, you may need to invest, funds, for the rest.
So you're saying don't commit an amount right now for this?
that as we go through the budget discussion.
And just put the 550 for the upcoming fiscal year.
Or if that's what you know, because it may be
Okay, that's fair.
that, that you bring back instead of what it says in number 2, that I'll bring back, a suggested, funding for the upcoming 20.
Lee, I think it's important we do have a number. I mean, because the county is basically putting a number. What the county did at the last meeting was say to the manager, you're developing your budget for fiscal year 25-26.
All right.
Make sure this 250 is in there.
But you also said you may come back for more,
Well, I said that, but if there's not a number that the trust is doing, it's going to be hard for me to come back for more.
So how about, may I change the recommendation? I would like the recommendation to be for the Children's Trust to commit $550,000 over 3 years,
Per year, for 3.
per year for 3 years
3-year moonshot.
for literacy.
I move staff recommendation.
Would that change?
Okay.
I have a second? Got a second from member Certain. That's even better than what I thought. So thank you for that. Okay.
And also, as I said last time, y'all might want to see what happened in Mississippi.
Right.
From, 477th to 8th in the country. So they did something right. And learn what they did and see if we could, how we can incorporate some of that into whatever we do.
Okay,
Thank
any
you.
further discussions? Got a motion and a second. So the motion is for staff's recommendation with a 3-year, $550,000 per year commitment. Moonshot, member Certain. Dr. Patton, are you on? Do you have any comments? She might not be able to hear. Nope. Okay. All right, let's move to the public. Any comments from the public? Once gone twice. Let's bring it back to the board. Any further discussion? All those in favor say aye. Any opposed? I did.
Yeah, that's why, like, I'm not saying anything because I'm.
Lee, I mean, Lee, this
Out
is-
there, let me let it go on,
Listen, he does squeak, but the reason this board is here has a lot to do with the squeaky shoes. So thank you for making the motion. All right, that's great. I can't wait to go to Newberry tonight. Yeah, we're gonna have a good discussion there. Okay, moving on to item 15, which is new business, funding, performance improvement plan updates and recommendations. And let's see. Got the requested action is the board is asked to 1, receive the information on the performance improvement plan process, 2, approve the following actions, implementation of a youth mentoring plan, and authorize staff to reduce the contract award amounts, terminate certain contracts, and increase funding to providers deemed by the trust staff as having capacity to expand their services. The reduction amount is $109,591. And Lita, are you doing this one? And okay, you are recognized.
You.
Thank you. Oh, that's kind of loud. Belita James here to provide updates on funding, performance improvement and recommendations moving forward. As this is a part of our continuous improvement process. Additionally, you will hear from Bonnie Wagner from our research planning and evaluation team regarding mentoring. So for our performance and fiscal monitoring process, our performance and fiscal monitoring process includes multiple components designed to ensure transparency and accountability. We conduct check-ins and mid-year evaluations to review both performance measures as well as expenditures. Also, it helps us to identify progress and challenges early on. In addition, we offer ongoing data and fiscal training to support providers in meeting expectations. When providers struggle, we implement individual success plans, also known as improvement plans, tailored to address their specific gaps, whether it is performance or finance related. This process ensures that our funded partners have the structure, the guidance, and support needed to align with CTAC goals and deliver effective services to youth and families. Because we are more intentional this year with our mid-year reviews, I'd like to briefly walk you through the process, the evaluation process. We documented all assessments in the mid-year evaluation tracker, which is available as an attachment for your reference. That was also included to say that is attachment a part of the staff report. The evaluation looked at 4 key areas for each program, that is fiscal management, service delivery, data quality, as well as performance metrics. Each of these areas was scored by the appropriate department on a scale of 1 to 5. 1 being emerging, no steps toward improvement. 2 emerging, there's some starting improvement. 3 was advancing with support. 4, advancing with minimal support, and 5 is mastering, which means they are exceeding expectations without much support from CTAC. These scores were totaled to produce an overall score ranging from 4 to 20. 4 to 8, program needs significant capacity building to continue future funding. 9 to 15, program has potential to succeed, targeted support. And 16 to 20, high likelihood of success with minimal support. These evaluations inform decisions such as budget reductions, performance improvement plans or success plans, and in some cases, contract terminations. When this report was completed, there was a total of $109,592. Since then, it was mutually decided to terminate an additional contract, which will bring the reduction total to $149,417. The recommendation is to reallocate these funds to support Goal 2, ensuring that all children receive the support they need to succeed. Specifically, we focused on expanding enrichment services and early learning opportunities, as well as it has been decided to include it in Goal 3, which is focused on safety. And there are any questions, I can take it at this time. And also I will have Bonnie Wagner to come up and discuss our mentoring. So we can take questions now, or we can wait until Bonnie. I can do that.
Questions now before we get to Bonnie? Or should we have Bonnie come up?
I had a question. I don't know if Bonnie's gonna, these sheets, is this what Bonnie's getting ready to go over?
No.
I have a question on, page 102 for us. So there was a few of them that had 0, in the total score, and I was wondering about that. And then there were, couple, I thought there was a comparison being made. It looks like I think there were some 24s in there. And the red and green and all that's kind of like just kind of throwing me for a loop there.
Oh, okay, I'm sorry. Yes. Well, the ones where you see 0, that is probably because we did not, those were contracts that were signed a little bit later in the contract year, so they did not, we did not, it wasn't a mid-year. That wouldn't be fair to have a mid-year evaluation for those, because those are some that we just signed. As far as the comparison, yes, we did look at where they were. That's just to remind the staff of where they were in the fiscal year 24, just kind of reminding us of where they fell and then have they improved from where we looked at them at the end of the year.
Guess what kind of threw me. That are like red. But I heard you say that 4 or higher they were.
Well, what we did was individually we scored them, but then there's a score that's tallied together. So you may have fiscal may have given them a 4, contract manager may have given them a 4, and then research and evaluation may give them a 4, and all of those are tallied together.
So we should look at the far
blast,
right, the far
yes.
right column.
I just wanted to show you the process of how we got to that total number.
Really good. Yeah, really good. Any other questions before we get to Bonnie?
below was the cutoff, is that?
Yes, from between 4 to 8 were the ones that we then considered either doing budget reductions or contract terminations.
Hey, Bonnie, go ahead. You are recognized. Normally you have to turn your microphone way down.
So this one works, okay. So mentoring is a strategy identified in our strategic plan to affect the goals of children can learn what they need to be successful, and also that children live in a safe community. And they were identified through input received in our listening project, and as well as ongoing solicitation of youth perspectives. We asked in our mentor mini grant, who received group, asked those youth as well. We did a survey at the end to get their feedback on if they would be interested in a one-on-one mentoring experience. We learned that 71% of youth were interested in a one-on-one mentoring model. Among our youth that are in mentoring programs right now, we asked them why they signed up for the program, and largely there's a few themes that the desire for belonging and connection, to wanting somebody to receive advice from, guidance, personal growth, and then interest in the program focus. Some of our programs focus on academics, some on athletics, and they were interested in that, and because the program was recommended to them. So it was definitely a strategy that our community was wanting, and that we learned through the listening project, and the board decided to include in our 3-year plan. Mentoring also is very well aligned with a lot of the key indicators that we selected to focus on, the ones that are shown on this slide. And mentoring has an evidence base for positively impacting the key indicators. Research has shown mentoring to be effective in reducing delinquency outcomes, promising in reducing use of alcohol and drugs, improving school grades, academic achievements on test scores, social skills, and peer relationships when done with quality. So mentoring programs are best positioned to demonstrate positive youth outcomes when they're meaningfully structured, purposeful, and regularly assessing program implementation and quality. The best practices for mentoring have been codified by Mentor, a national organization, via the Elements of Effective Mentoring Practice. That's a guidebook based off of decades of research and practitioner expertise. The program activities that the CTAC required of the funded mentoring programs draw from this guidebook and include the elements listed on this slide. But these were also our performance measures that were implemented and that we implemented. On our next slide shows our program results, and these are reflective of the midpoint of the year. So that's through the end of March. So this is our second year midpoint. So this is after year 1, and now we're in year 2. And I reran the numbers last week based on data and through the end of March. And we've been sharing these results with the providers all along individually, as well as bringing us together to talk about the results and collectively review, find out what's working. Our last convening was on March 31st, where we brought all the folks together to review a slide that looks very much like this, as well as to discuss and get their feedback and talk about best practices in the future. So our funded mentoring programs struggled to provide, track, and ultimately demonstrate the program activities on the previous slides. You can see the one that was most problematic was the one-to-one match meetings. All our providers were below where they should have been in the target. So the number outside the parentheses was where they were at midpoint, and then the number inside the parentheses was where they're supposed to get to by the end of the year. And the gray indicating that they're sort of below where they need to be, given what the progress of the year should be at that point. And then in the bottom, how well the parentheses next to the measures where the target is for the year, and then where all the providers fell at that time. So the one-to-one mentoring was really the area that was difficult across the board for all the providers. And then also some of the providers indicated a lot of difficulty finding it, recruiting, retaining mentors. So what we'd like to do at this point, given that what we've learned from our 1.5 years of implementation, is we want to consult with experts to seek and leverage technical expertise in program planning and implementation. What we can do better. I've already submitted a request for technical assistance from the Office of Juvenile Justice and Delinquency Prevention. They have a national mentoring technical assistance program. We also have a local affiliate, Mentor Florida, that offers technical assistance. I think there's a lot of great resources that we could be leveraging to really build up and strengthen our programs locally. I think also in that process, what we would plan to do is to further explore the needs and interests of youth mentors, program staff, listening sessions, learning what they would like to be supported and how they would like their programs to be strengthened. And then once we gather those first 2 steps, to then offer professional development opportunities, resources to cultivate the capacity so we can really come back stronger and develop a program that is framed out to deliver high quality, impactful mentoring for youth. With spring 2026, having that framework and strengthen providers to apply and start with contracts in October 2026.
Okay, thank you, Bonnie. Questions, members? Member Turtle.
Thank you. Bonnie, when you, the calendar that you had that showed the results, there was one column that had 0% in the high well. Second column from the left. Received monthly check-ins. There were 2 values that was 0 there. Does that mean that they didn't get their 90% or that there was no contact for those?
There was contact with that provider, particularly their data entry was usually 2 to 3 behind where it should be. So the data wasn't entered. So they were meeting with their folks, but it didn't measure up to the average of 1 meeting or more per month because their data was delayed in getting entered. And enter the data to evidence that they were meeting on a monthly basis with the parents and the.
And so I was looking up at the top, it said the youth mentors, so you said the outside number was where they currently are and the target was in parentheses, correct?
Yes, that's correct.
Then their one-on-one match meetings, they have 1,080 target for it.
Yeah, that's based on the number of kids, and then we want to see at least 2 a month. So for some programs proposed in their original proposal that they would plan to meet weekly. Some programs had to do a minimum of 2 per month. So the ones with lower targets for that might have proposed a lesser frequency or have a lesser number of youth. But basically it looks at the number of, 12 months times the number of youth times the proposed frequency of match meetings. And then build in some wiggle room for missing a few weekends.
I know it just looked skewed. I was looking because it was 1,080 and then the one that's to the left of it was 1,000 and they have double twice the students. And so I don't know, but thank you for.
The impact in particular had proposed to meet weekly with their youth.
This, when this all started, this board was really adamant, we gotta have one-on-one mentoring. And that was the whole purpose behind the funding. And I think we're 1.5 years in and staff is saying, we've gotta course correct.
So I think as part of that conversation, I remember us saying that possibly they put into their thing, like they pay their mentors instead of asking everyone to do it. Volunteer, they may be able to get students who are there. I'm not sure if any of the programs took us up on that suggestion of having a stipend of some type as part of their model.
Have one that did that approach, and the others chose not to do it, but they were open to do that. They were open to pay their staff. Some, only one chose to do it.
I'm really surprised with UF students, Santa Fe students, with seniors that have dual enrolled and have time, that some of these organizations are not able to attract more mentors.
Especially like that, is it family youth and children's, that college that's in there, they have a lot of their graduates that have to have like hours.
Have to have so many hours, yeah. So I'm supportive of staff kind of stepping back, giving some more recommendations and really.
Yeah, if I may, thank you, Bonnie. This one was hard. We kind of had to have multiple conversations about it, because we really do value mentoring. We know you value mentoring. And I said to staff, if kids are showing up, do we stop? Right? Because that means they're getting something out of it, even if it's not being done the way we wanted it to be done, right? There may be group mentoring versus the one-on-one. And so we did what we always do. We reached out to some of our partner CSEs. How do you all do it? What are you doing? This is a statewide issue. Many of our sister CSEs have ended their mentoring programs for literally the same reasons. So what we decided was we had 2-year contracts. Let's kind of I said pause, but then I said, well, if the contracts were ending, it's not really a pause. But we want to come back to you all. We want to come back to our providers that are doing the work. We want to build capacity. We want to find out what the best practices are so that we can bring in some of those national experts to meet with our folks and to help us kind of design how we do this moving forward. And that's the real recommendation. Because what we know right now is that they've all struggled. And it's continued to be a struggle for them to do it in the way that we asked them to.
I have any more discussion? Otherwise, I'll look for a motion. My only comment is, I believe we are all going to be on the front line when we go to renew this special taxing district. And I will be able to say that measure when something doesn't work, we correct, we stop. And I am a huge proponent of mentoring as well. Not getting results that the providers and this trust need to get, then I think we got. Much as I hate to stop the funding, I support the course correction and I believe in. Hey, this is what we did and it improves. I think so. Even though the program. Hopefully.
I think, I can agree with what Lee says. I think the out-of-school time providers, the after-school providers, I think there's a lot of mentoring that goes in that. I think us possibly investing the funds that are in mentoring into after-school programming so that we can reach more youth, I think is a better use of those dollars. And I think, maybe we have this suggestion of we look at the students who were involved in mentoring to see if they're connected to another program that we're funding, that we may find that they are. Through TunesWorks, be it through one of the after-school providers or that we offer. So it may be a cut, it may look, it sound like we're cutting, but it may be that they are already connected in some other way. But I think that maybe we give the funding that we're putting here, we look to put that in the after-school and summer programming, because the same challenges with providers being successful that we're talking about for the pre-K and child care, those are the same types of challenges that the out funding that it takes to have staff and well-trained staff, not just people like babysitting, like having good programming that it costs money to do that. And some of our students and the children in our community that have the greatest needs and maybe exhibiting the most challenging behavior or dangerous behavior, it takes a lot of money to serve those students. Those student staff ratios, and I know that's not something, you know, Leah and others have talked about having a standard amount, but I'm speaking from the point of being the treasurer for one of the funded programs here. And it is expensive to have a mental health counselor on the staff. But when we were sharing one, we found that that wasn't meeting the need. We had to bring that on staff. It costs money to do that. So that puts you out of the range, you know, but when we think of the impact and the touches we've had on the students, what would our community be like? Back in the cost that it'd be to the community.
Huge investment, that's paying back.
Investment versus an expense of it.
That's
is how
right.
we have to
No,
start.
I use that word intentionally. Yeah, thank you, members.
All our providers annually at the end of the program year will do a provider reflection where they will give feedback on their successes, accomplishments, challenges, barriers to achieving. Also have a annual survey where we ask them about to give us anonymous feedback on our processes, relationships with staff, what they'd like to see us improve upon.
And I'll just comment, you know, when we stood this board up, when there were 5 of us, you know, no one more than Member Certain and Judge are teenagers. And talked about this 3-year moonshot. I mean, I think you have Santa Fe, we need mentors when we need to really go to them. Got kids that are trying to get into the profession that have hours that they need to make. We mentors in this community. And so I think this time that we take, hopefully we can make. Okay, any further discussion? All right, any public discussion to the motion? Come on up, introduce yourself and give us your thoughts. comments. Thank you. That's what we need. Appreciate it. What else? Bring it back. Oh, come on. Okay. Hey, no, that's okay. Go ahead, Sherry. Thank you for being here.
Advocacy Center here. So Aldrika could not have said it better. Those are some of the same things that I about, but I would take it even one step. Comments through the years about how do we meta these programs? How do we bring kind of multiple that's bringing some training, want to be mentoring the older students. I think there's professional development programs over here. Collaborative, more supportive.
What else? Board? All those in favor say aye. Aye. Any opposed? The motion is unanimous. Okay, thank you, members. We are now to the second opportunity for the public to give us their general comments on anything not on. And since the first one, but this will be a time. Go ahead and introduce yourself and give us your thoughts.
Good evening, everybody. My name is Patrick Dodds. I'm the Executive Director of Bread of the Mighty Food Bank. I wanted to speak to you all tonight with an opportunity in hopes of finding a way for us to partner to solve one of the more pressing issues in our community, which is childhood hunger. The most recent data that we have shows that 1 in 5 children in our community is food insecure. Numbers get worse as you dive into demographics. In the African-American community, it's 1 in 4. And in some of our more problematic zip codes, 01, 9, 41, 15, it's higher than 25% food insecurity. So I know one of the things that we're talking about tonight is how do we create healthier outcomes for children and support to achieve how to create safer, more resilient communities. We have to provide them with their basic necessities. High quality centers and provide them with as much high quality education, but if they are hungry, they're not going to be able to focus. They're going to have behavior regulation issues, absenteeism and truancy. And what we would like to do in hopes of finding common ground is reach out to several partners, including the county and the school board. Nobody funds school pantries. We currently are in 6 of the nearly 70 schools within Alachua County providing a school pantry. Our sort of back of the napkin numbers is that we can provide a basic pantry for about $5,000 per school per year. So the $5,000 will provide up to 500 pounds a month into each pantry in each school. So provide somewhere between 30 to 35 pounds of food each month for up to 100 families in each. I think we would want to look at starting small in our higher needs schools. We also work very closely with our partners with the backpack programs who have a lot of success in elementary schools. So struggling and not accepting the backpack programs because they are a scarlet letter, right? You are walking out of school with something that says, I need help. And so we would look to focus in the areas and where we're not going to be duplicating the efforts. If you've read the news lately, you know that pantries and food banks are receiving less funds than ever before. What that means is we are contracting the programs and services we currently offer, and there's less food going out to the community. Partners to come up with as many creative opportunities to get food to the most vulnerable. The data that I shared with you is from 2023 as well. So skyrocketing price of groceries we've seen in the last year. Harder than ever, there's less food and banks on the pantries. We think a great way to try and accomplish these goals is to partner to get,
Else?
I'm Jennifer Reeves, and I'm with the University of Florida. And I do know, today I reread the, I just wanted to say, I'd love to have us at the table in July. I'm the community outreach coordinator. I had been in retirement and came out to kind of help with that. So love hearing everyone who's already spoken, especially Child Advocacy Center. There are ways to do a lot of layering and not duplicate. I was former director of the Mentor Center in Alachua County, funded by the Gainesville Community Foundation. Very familiar with all those challenges. I do think the good news is with the Children's Trust and the partners you have, there's a great opportunity to do exactly what Sherry said. Just wanted to.
Thank you for your comments. Thank you for being here. I'm sure you'll be grabbed before you are able to leave by our staff. I saw them all looking around. And welcome out of retirement and back into the working class. Okay, anyone else? All right, let's bring it back to the board. So before we get to the information items, well, let's go ahead. Yeah, so there's informational items, provider highlight by DJ Elio, maternal health contracted community partner, the maternal health contracted community partner update, and the final summer camp contract list. Before we do that though, let's, any board member comments? We'll start with online. Are there any comments from our board members online? Frozen, okay. Member Shortly.
Scott, would you send to us the trim calendar? Like I could put them on we can put them on our calendar. I want to make sure.
Judge, got anything? Member Chance, anything? Member Pigs? Okay, okay, I don't know how to do this one, so I'm gonna just turn it over to Marcia, because man, oh man, y'all. Go ahead, Marcia.
Earlier was thinking, when are we going to do this? I have an announcement. It is, I can't even say bittersweet. It's not sweet at all. Our chief financial officer will be leaving us. I know. For all the right reasons, he will be leaving us. I don't want to share specifics. If he wants to do that, I'll let him do that. But his last day will be our June meeting. He's going to get us through audit and our budget. But I have to say, we owe Scott a debt of gratitude. In my short tenure here, we have not had anybody more adept at our finances, understanding the big picture, visioning. As you saw, he was over here grabbing me saying, no, 3 years. And we had already had this conversation and I was over here tongue-tied. He has been a jewel and a gem. I jokingly said this morning at our staff meeting that he brought a lot of heart to the trust. With Scott, you get heart as well as intellect. We will not replace him. We will hopefully find someone who can certainly manage our finances, but we will not replace Scott Sumner. So again, thank you for everything that you have done in your very short tenure with us.
Scott, you want to say a
I
few
didn't
words?
mean beating you in cornhole so y'all. I didn't know.
That's exactly the reason why, Tina. Because you beat me in cornhole. Although you told me I had to let you win.
No. Remember I
He
said.
doesn't let anybody ever let win. Yes.
Everybody knows that.
You said you're used to winning. So just a couple of things, and I'll try, not to cry, although I won't be successful at that. I was not looking for something. Um, and I don't know that many of you know my background in academic medicine, the Health Science Center here, among other places, that I departed, February a year ago. And along comes the trust, and like I said to Marcia, um, uh, rescued me, which I needed. Um, and an organization sought me out. I was not being advertised for recruitment, any of those things. Um, I will say that there's a part of me that's been missing since I left my last job. Not that this organization didn't replace a really big part of that in ways I never expected. Really meaningful work for the community that I have not experienced in my career. But I have a standard that I would be looking for, very much like what I find here. And that is an organization whose leadership is unified, it's highly collaborative, that is committed to each other in the bottom line results of the organization. This particular organization just captivated my attention. It means I have to move. My husband and I leave my family. Not an easy decision to make. And, you know, was a difficult one to wrestle with. I will say that I'm going to Johns Hopkins University and their health system. Remarkable to me. And it's a calling I could not pass on. And Marcia and I are already talking about, you know, how do we provide a plan so that the trust does not lose trust in the finance shop, which is really important. We've made a lot of really great progress in a year to get through audit, to get through budget for 26. And I will work my hardest to do that. It's not easy. I will miss this.
I have some words to say, but I want to leave it to my members first. Give you a second to, any words from our members before I need to say?
Well, but he's far more than.
Oh, it is more, but I'm just saying, it's just.
Well, that's a national problem.
I know.
That is gonna pay dividends.
This sucks. You know, I had the pleasure of working with Scott, came in here and signed a lot of checks, or well, signed a lot of papers. And got the opportunity to know him. And you know, he's just a good human being. You know the numbers, and you've done remarkable things with where we were financially. But the other part is that you didn't limit it to just stay in your room with the accounting function. Your fingers were in everything, and your advice and your counsel and your input, you know, really has made it a much better organization. And Marcia's absolutely right. You know, we may get an accountant who may do an excellent job, but you know, you're gonna leave. You know, and wish you the best of luck up in, I guess it's Maryland. Yeah. But, you know. Yeah. Not that I want anything bad to happen. But, you know, I'm gonna miss you just as, you're the type of person that, when you're around Scott, you're a better person for it. So, I'm gonna lose a friend and that's that. Good luck. All right, thank you.
Thank you, Lee.
And I remember when you came in and sat over there, that first finance committee meeting, and we were having a discussion, and there's this very tall man in the back that just listened and observed, and then the next thing we knew, we found out you were joining us, and I can tell you my tenure as treasurer, you just made it so simple for me. That was the easiest gig I've ever had. Because it's like if I missed an email and then they started bets on how fast I'd respond to the email, and I got a gig, and then I felt like I had to watch for anything to come across so that I beat the last time. So it's an amazing opportunity, it sounds like, and I wish you and your family.
Thanks, Cheryl. Yeah, Scott, first and foremost, thank you and congratulations. I mean, really congratulations. I remember when you joined this organization, we had a conversation and this wasn't anything like like the opportunity you are being presented now that you were looking for. It was something that you came to a couple of meetings and were like, I think I want to be a part of that. And Lee's so right, the people that get to interact with you are better because of their interactions with you. Came to the trust when the financials needed to be tightened up. They needed to be improved. Systems need to be put in place. And you have done all those things. And like Lee said, the trust is better because of your time. The community is better because of your time here. I don't ever say goodbye to anybody. I'll just see you around. We don't say goodbyes. We'll just see you around, but I wish you all the best. I know that you will do everything that you need to do for the next person to step in that very big void that you are leaving. And I couldn't be happier for you and your family. All miss you very, very much, but thank you. Just thank you for the time that you gave this community.
My honor.
Okay, let's give him a round of applause. Not sure we'll have a plaque or something for the last meeting, but we'll be able to do this one more time. Hate to surprise you guys on that, but that was how Marcia ruined my Friday or Saturday or whenever the hell she told me, but that's okay. Okay, I already went over the other information that was provided. Our next meeting dates is our next board meeting, which will be June 9th at 4 o'clock. We're gonna have a board workshop 2 hours before that at 2. So hopefully everyone will be able to attend that and we'll go through the fiscal year 26 budget and have some workshops. We'll have a finance committee meeting before that. Yep. And to help prepare for that.
You all should be receiving an email from us, if you haven't already, about a July retreat. It will be our strategic planning retreat.
Oh, that's right. Thursday. Right? Did we
Can't
set the
remember
date?
the date. I think we sent you two. Have we sent that email yet, Katura? Just to Ken? Okay, so you all will be receiving early to mid-July. We're trying to stay away from the end of July because we know a lot of you take vacations toward the end and not 4th of July weekend. So it's somewhere in the middle. The 17th?
Yep, so, go ahead and look at that for a board retreat. Leave your things and fill out your evaluations, and we are adjourned at 5:58. We made it. Thank you all.